I'm Stephanie Fraser. I'm a surgeon based at Guy's Hospital, where we've adopted robotic-assisted bronchoscopy. So what that means is we take a very slim, flexible camera and we can guide it down into the lung to sample potential lung cancers. Traditional bronchoscopy couldn't reach that far, but this device gives us the technology to map our way down deep into the lung and reach spots that we couldn't get to before. Just to show you how small that is, over here you can see that's a tiny camera. But despite the small size, we get an excellent view. So the screen behind me shows just how good the quality of the view is within the lungs. The other advantage to it is, although I'm in complete control and I'm driving it from the machine here, the device is held perfectly still with a lot of accuracy. So that means we don't cause a lot of trauma to the airway. It means when we drive down someone's throat into their lungs, we're doing that with precision without causing trauma. When a patient has an X-ray and a CT scan that shows something in the lung, a shadow, or we call it a nodule sometimes, that could be a potential small cancer, this is a way for us to guide something through the patient's throat down into the lung to be able to sample it to know for certain whether it's a cancer or not. What that means for the patient is they can have a test where they're comfortably asleep, and we can get to the answers, avoiding the need for repeated procedures, and try to get them the answers that they need as early as possible. Since we implemented this, we have absolutely seen a shift towards being able to diagnose cancers in the earlier stage. So some of our colleagues have diagnosed cancers as small as a few millimeters, and that makes a massive difference for patients. It means they can go on and have treatment in the earliest possible stage and have the best chance of a long-term cure. I think robotic-assisted bronchoscopy is a real game changer. It means for patients that no matter how small the nodule is or the area of concern, and no matter where it is, we can reach it. And that means that any cancer that's potentially in the early stages could be diagnosed and treated as early as possible. And also what that means for patients is fewer repeated tests. So that means fewer times back and forth to hospital, less time waiting, less distress, and overall a shorter period of time from the time that they present to a doctor with something they're worried about to the day that they're getting their treatment. Most patients would be candidates for robotic-assisted bronchoscopy. It is done primarily under general anesthetic, so we do some assessments beforehand to make sure that they're fit for a general anesthetic. But my experience so far is that with the right support and the right investigations in advance, most patients can be candidates for this. It's incredibly safe, and largely patients have very few symptoms afterwards. So overall, it's really excellent and safe experience for the patient. I think it's really important that patients have conversations with their team. So that could be their chest doctor, their surgeon, their oncologist, their cancer specialist, about what options are available to them. If they've got something that they're concerned about, or a scan has turned up something that's worrying, it would be ideal to have that conversation about what options are available to them and what the benefits and potential risks of that would be. But I think increasingly we'll see this forming a big part of the lung cancer pathway from the earliest stages onwards.